Hi, Dr. Dressler here, and this is Jake. And the reason why I'm making this video today is because Jake has to travel. His pet parents have to relocate, and one of the things about Jake that you can see is he's kind of a nervous little dog. He's got some anxiety problems. And so pet transportation can be connected with anxiety just like it can be with us human beings. So one of the best things to do, and I'm going to explain this to her mommy, to Jake's mommy rather, is to get Jake used to being in his dog kennel. And the way to do that is by feeding him in his kennel every day, so he has to go in and out of the kennel to get his food. Another thing to do is take Jake for trips in the kennel so he can get used to the feeling of the movement and that type of thing, so it becomes a very positive thing day to day, especially if it can be connected with special treats that he gets, like lean meats that don't upset his tummy or don't create allergies. Usually if you have a good treat, one special treat that they really like that's reserved for those things that are really challenging for them, that can be a good way to create a positive association. Now, on the day of travel, we've got to make sure that Jake has a good walk at least 2 hours beforehand so that he can do his business, and also is not provided food. Well, this depends on the length of the flight and all these types of logistics, but what we don't want is to have him needing to go potty while he's on the airplane. So a little bit less food initially, water is okay. Another thing to think about is whether or not you want to freeze a water bowl full of water and attach it to the side of the carrier so that he can lick that. It's always going to be good to put a little article of clothing or a blanket or something like that that has your scent on it so that your pet can smell you during travel. Finally, the question comes up about sedation. Well, in worst case scenarios, yeah, especially if they're having severe anxiety and trying to escape from the carrier, sometimes we'll use a little Benadryl, sometimes we'll use a little theanine or a little melatonin. There are some nice herbal products out there that can be effective. But the best thing to do, remember, is start early and test these things out. Maybe you can get away without them. Most of the time you can. Or maybe you only need to use a half a dose. It's always best to use less of these types of things if at all possible. But anyway, Jake needs to get back out the door, back to his mommy. So thanks for listening.